We may recall last month we were at the Medical Oncology Center of the Singing River Health System, and today we're at the Radiation Oncology Center talking to Stephen East, who's the Director of Cancer Services here. How are you?
Good, good. Welcome back.
Well, thank you very much. Now, as I said last month, we were over there, we're over here. Tell us about the different locations that y'all have.
We have two locations. We were at Ocean Springs last month, and this month we're in our Pascagoula office. Here we have our radiation unit, which we're going to feature today. But we also have a medical oncology unit as well. It has a clinic and a chemo area, just like you saw in Ocean Springs.
I tell you that there's a lot of great things that with the two centers, and y'all have really achieved some greatness and notoriety too with the great services you provide.
That's correct. We are accredited by the American College of Surgeons. They're commissioned on cancer. We've been accredited for 19 years now. And recently we were accredited with or recognized by CareChecks as providing quality patient care in cancer and quality patient safety in cancer.
That's where you really want to pat yourself on the back because of the attention that you got and the knowing the type of service that your patients are going to get.
That's correct. And I think one of the good things, and we'll go to see that in just a minute, is our radiation staff right now is in their chart rounds. Once a week they go through every single patient chart. They see where they are in their treatment. They look to see what other services they might need. I really want you to see that. So why don't we go take a look at that?
Sounds good. Let's go. Dr. Brad Greenfield is the radiation oncologist here at Singing River Health System Cancer Center. Tell us what's going on in here right now.
So this is what we do weekly, chart rounds. We discuss patient cases every day, but at least once a week we get together and we make sure that everybody is optimized and treatment-wise from initial consultation all the way through their treatment planning. So we go through individuals, and we have social workers here, we have our nurses here, our therapists, our dosimetrists, and our physicists here as well, in order to make sure we optimize the plans and make sure that patients get the best care.
All right, well, we want to go check out one of the exam rooms here now at the Radiation Oncology Center at Singing River Health System in Pascagoula. Well, we're in one of the exam rooms. Dr. Greenfield, tell us the difference between medical oncology and radiation oncology.
So for cancer care, there's three different pillars of treating cancer. So there's surgery, chemotherapy, and radiation. So chemo is a lot different than radiation in respect that you usually get injection, and then it's a systemic therapy in which they try to sterilize all the little microscopic cancer cells that go throughout the body. Radiation is a more focal type of treatment that isolates just to the area we're aiming at, and that's how we sterilize the cancer from that perspective. Radiation, how I like to explain it, is like getting a chest x-ray or a CT scan.
Sure, yeah.
You don't see it, you don't feel it, the energy goes inside of you, the machine goes around you, and when the energy is a little bit higher, and we can shape it to exactly where we want it to go.
So as you said, it's targeted in one area.
Yes, so targeted one area, so we avoid all the normal structures while treating the cancer exactly where we want it to go. And the technology we have here at Singing River, I can deliver that within millimeters of accuracy.
Wow. That's pretty good. I mean, and the medicine has come so far in treating cancers nowadays. What's the next step from there? I mean, once people come in, what is the SIM thing?
So a CT simulation is the first step of planning and treatment of a patient. So after we do a consultation and I do an exam, we take them to the CT sim and we do a CT scan in which they lie down flat on a table, and we do a CT scan in order to make sure that everything is exactly where we want to be, and they can be reproduced on a daily basis. Most radiation is not done within one day. Most of it's done little doses over weeks.
Okay.
And that's just to make sure that the cancer gets treated and dies off while the normal tissues heal in between the treatments.
All right. Well, we're going to go talk to one of the SIM therapists now. Now, Lindsay McDuffie is a radiation therapist. How are you?
Good. How are you doing?
I'm fine. Tell us about the SIM CT.
Okay, so in CT Sim, we bring a patient in after they see the doctor. We bring them in, get them in a treatment position, so that way we can deliver a treatment and spare as much healthy tissue as possible. So we'll get them immobilized and as comfortable as possible. We'll get them very straight, put some marks on them so we can reproduce that in the treatment room. And we'll do a CT scan. It depends on what the doctor orders. We can do anything from a respiratory motion monitoring to adding IV contrast, creating a mask for treatment to immobilize the patient, different things like that, just depending on what's needed for their treatment. So we'll do the CT scan, document everything, and then we'll send it off to the dosimetrist, who will start working with the doctor to create the treatment plan.
Alex Plowman is a dosimetrist. Never heard of it. What do you do?
What we do after the CT scan has been performed, The CTs are brought into our planning software, which then the doctor helps draw the tumor volume and other normal structures that may be within the area where we treat. So once that's done, the doctor asks us to perform a plan that will treat that tumor volume and at the same time reduce dose to what we call normal critical structures like the eyes, the brain, the lungs, spinal cord, stuff like that. And once we've done a plan, then he approves it, then it goes to physics for QA. And then after that, it goes to treatment.
All right, well, we're going to go to the Trilogy Vault now. Matt Storr, radiation therapist here at City River Health Systems Cancer Center. Tell us about this beautiful machine.
This is a Varian linear accelerator. It's a Trilogy unit. It's capable of many different things. We have the rapid arc system where the machine and the multi-leaf collimation system delivers radiation to a patient, and the machine's rotating continuously around the patient while delivering the radiation. We also have the respiratory gating feature where we're able to monitor a patient's breathing process to make sure that we're not treating more tissue in the lung or the heart.
Wow. I mean, this pretty much just, and it can target, you can program it to target where it needs to go.
Yes, sir. We have imaging capabilities where we can take a cone beam CT of the patient before we treat and compare those images to the original images taken in the CT planning room.
All right, well, we want to go to the HDR Vault and talk to Dr. Greenfield again here at City River Health Systems Oncology Center. Now we're in the HDR Vault. Dr. Greenfield, explain what HDR is, please.
So before I spoke about external radiation, that's when a machine goes around you and treats you from the outside. HDR is how we treat from the inside, in which we get a very high dose of radiation to the patient and the tumor itself without the normal tissues being exposed. So it's a very high tech type of treatment that is kind of a standard of care nowadays. And here in our newly renovated HDR suite, you know, we treat endometrial cancer, we treat cervical cancer, and have potential to treat in prostate, pulmonary, and other cancers as well with this high-tech treatment.
Now, the great thing, Stephen, is the fact that you can treat cancer needs of South Mississippi right here in Jackson County.
Oh, that is correct. I mean, we can do just about anything we need to do, and we find that medical oncology, radiation oncology, even though some of our patients may want to go out for a second opinion to a larger tertiary center, they still want to come back to us for their treatment. We treat them like they're our neighbors and our family, and we provide excellent service here.
Well, the biggest thing is that you want to make them feel at home.
Absolutely.
And that's what they do.
And there's no place better than home to be, especially when you have cancer.
All right.
Thanks a lot.
Appreciate it. Thank you very much. We've enjoyed being here at, like we said last month, we're at the Medical Oncology Center, and this month we're at the Radiation Oncology Center. Either way you need them, City River Health System is the place to go to.